Hi everyone. Today we're going to talk about client satisfaction, sort of as a unique case of program evaluation. So what we're going to talk about today, just some of the different features of it, what makes it important, what its advantages are, but then we're also going to talk about sort of all of the problems that are kind of inherent in using client satisfaction as a dimension of program evaluation. The biggest, I'm just gonna foreshadow that part of the lecture here for a second. The biggest issue with client satisfaction is that it's not necessarily a measure of change. People can be really satisfied with services. They can really like the social worker or the human service worker that they're working with. But they can sort of not have changed or not have improved in the dimension that they need to, and that's a problem. So the way we see client satisfaction used these days is sort of as one dimension of sort of the delivery of services. So oftentimes these days, what we hear about are outcomes, cost, and client satisfaction. And if you happen to live in New York State, there's sort of a series of Medicaid redesign projects called DSRIPs. And some of the key things that they're tracking are cost, outcomes, and client satisfaction. So I mention that to sort of say, I think this is how client satisfaction is used these days. It's used in combination with other measures of performance. So the roots of client satisfaction, the roots of client satisfaction really stem back to the 60s and 70s and sort of this idea of a this consumerist movement. Some people might argue that this relates to neoliberalism, and I think you could make that argument. And just sort of the consumerification of services in general. Typically, human services and healthcare were shielded from sort of traditional market dynamics and things like customer satisfaction and client satisfaction and things like that. But that started to change in the 60s and 70s as people realized, for better or for worse, that people should be happy with the services they were getting, and happiness really is, or satisfaction with services is really a part of the dimension of change. If you think about it in human services, we're often asking our clients to do very difficult things, and so in some ways the deck is stacked against the provider. It sort of leads to, or sort of leads to a higher likelihood of the client being dissatisfied with services, just given the kinds of things that we're asking them to do. I mean, we might be asking our clients to cut down or stop or reduce their drinking. That's going to be tough for a lot of clients. So we know that they're already sort of going to be displeased or at least challenged by their worker, and that's going to have implications for client satisfaction. Same thing if a worker is working in one of the child protective agencies or something like that. There's automatically this adversarial relationship that predisposes the client to sort of a level of dissatisfaction. At any rate, one of the things I think that we do have on our side is that we, as social workers especially, we tend to view our relationship with our clients more as a partnership. And so that sort of empowerment of a client helps to undo some of that adversarial stuff I mentioned a second ago. But then, of course, the internet has sort of opened up all kinds of places for reviews. I mean, there are reviews of social service agencies on Google, things like that. But it's a dimension. It's something that people are thinking about. And then, of course, probably the real utility of client satisfaction is what I've listed in this final bullet point here. The client satisfaction studies really are useful because they can detect problems before they get out of control. And get out of control is sort of shorthand for cost the agency too much in terms of time or money or clients or reputation or something like that. So as I said, I think client satisfaction is really used as one dimension of several indicators. Oftentimes those other indicators are cost and some kind of outcome study, which we're going to talk about in other weeks. Okay. So there is there is some utility to monitoring client satisfaction. And that's primarily because clients are, in effect, functioning as customers. And so consumers who are unhappy tend to tell others and then not patronize that agency. They're going to take their sort of business elsewhere, if that's the word you want to, or if that's the phrase we're using here. The sort of landmark study on the relationship of sort of patient loyalty and positive testimonials was done in 1990 by Fisk and colleagues, and sort of the key finding from that study is that a negative word of mouth sort of is a more frequent occurrence than a positive word of mouth or a positive testimonial. So, in other words, if clients are displeased, they're more likely to tell people that they are than they're pleased. So the reputation of the agency, if it's bad, is likely to spread, and it's frankly easier for it to spread, according to what Fisk found. On the other hand, if it's a good agency, clients don't tend to report that to other people, or they tend to report it less frequently to others. And then, of course, the consequence of that is that the agency's reputation doesn't necessarily improve, or word of a good reputation doesn't necessarily spread. They found that sort of loyalty was sort of related to the rate of testimonials, and they use testimonials as sort of a phrase for how clients were talking about an agency to others. So they were essentially testifying to others that they were pleased with this agency, or they were displeased, or something like that. So if patient loyalty was around 95%, there were far more positive testimonials than there were negative reports. However, if patient loyalty dipped to 90%, there were only slightly more positive reports than negative reports. And then if patient loyalty dipped to 80%, there were more negative testimonials than there were positive testimonials. And you can see that decline in loyalty is not commensurate with the change in the change in positive and negative reports. So agencies have to work really hard in order to just sort of get people to give positive reports. I mentioned at least once or twice in this talk already that client satisfaction is a necessary thing, but it's insufficient. And so agencies like the Council on Accreditation and JCO and things like that oftentimes require studies of client satisfaction, but they also oftentimes require studies of client satisfaction in the context of other indicators of quality. If you're interested, the Council on Accreditation standards are online. You can Google them. Depending on what state or country you're coming from, you may want to look also for local standards, either state or province level standards or something like that, depending on who the regulatory bodies are. So client satisfaction has quite a few advantages, and frankly, they are useful to the agency. Like I said, they can detect problems before they sort of get out of hand. And part of the reason that they can do that is that client satisfaction studies are pretty inexpensive. They're pretty easy to interpret. They don't take a long time to sort of prepare and mobilize. I mean, the front desk staff who are sort of checking people out can say things like, on a scale from 1 to 10, how satisfied were you, or how pleased were you with today's visit, or something like that, and just sort of record it. That's a good use of a self-anchored scale there. It also sort of conveys to clients that their experience and their perception of things are important. It sort of conveys that, even implicitly, it sort of conveys that the agency or the organization values the client, and it values their opinions and perspectives. And then, of course, it's useful from sort of a managerial perspective, a public relations perspective, and that kind of thing. However, their problems are significant as well, and I sort of hinted at the big problem with client satisfaction studies, and that's that client satisfaction studies are not the same as outcome studies. So they're not the same as a summative evaluation. They don't actually tell us if a person changed. In fact, it's pretty typical that client satisfaction studies find good things. They find that clients are sort of satisfied with their services. That's true internationally. That's been true since Lebow did his study in 1983. And in human services in particular, despite the fact that we sometimes have sort of an adversarial relationship with clients, the other sort of fact of the matter is that our clients tend to like us. I mean, we're helping them with problems, we're getting to know them, we express empathy and sort of concern and care for them, and so that does predispose them to sort of being sort of generally pleased with client satisfaction studies. The good sort of heuristic is that if a client satisfaction rate is below 75%, so if more than a quarter of clients are displeased about something, that's a good indication that further investigation is warranted. That's also at that level where you're going to get far more negative reports than you are positive reports. So it's also sort of useful because the reputation of the agency is kind of in jeopardy there. The other thing to mention, sort of in the human service world with client satisfaction, is that sometimes agencies are really specialized. They might be the only agency that does this kind of thing in a county or in a city or in a region, and so clients have no choice in sort of that kind of facility. And that tends to predispose them to reporting high levels of client satisfaction, even though in that kind of context, when there is very little choice in the matter, client satisfaction isn't necessarily as important. So let's just talk about client satisfaction here a little bit. Oops. So it's not a measure of whether the client's needs are met, although typically what we think of as in the context of sort of service delivery, is that clients need to be satisfied in order to sort of have commitment and showing up. They need to be happy in order for the work to get done. So it's sort of a precondition to change and things like that. However, clients can be satisfied even when programs are ineffective, and that's, again, often due to that attention provided sometimes by the worker, by the therapist or clinician, something like that. Client satisfaction can be influenced by a provider's reputation, and that's important as well. People who have a really good reputation tend to have a cushion. They tend to sort of have this inflated rate of client satisfaction. Satisfaction. So another sort of key dimension of this is that satisfaction is related to age, both of client and of the worker. So as those things tend to increase, client satisfaction will tend to go up. It's important to note too that people who are unhappy with services tend to drop out. They tend to just stop showing up. And so we don't often have access to them to ask them about their satisfaction. Good client satisfaction studies use a combination typically of qualitative and quantitative responses. So, on a scale from 1 to 5, how much do you feel like your social worker listened to you? That'd be a good example of sort of a closed-ended quantitative question. And then maybe a short fill in the blank or, short answer question like, my favorite part about today's visit was, those kinds of things often provide illuminating information. The other thing that tends to provide illuminating information is one thing that could be improved about the visit was, or something like that. Telephone surveys typically yield a higher response rate. And so those are useful sort of, phone calls after the fact are useful for client satisfaction, but that sort of challenges the idea that cost and an easy implementation is part of, or that sort of challenges the notion that cost and ease of implementation are a feature of client satisfaction. Telephone surveys actually require quite a bit of organization and resources and things like that. Mail surveys don't have nearly as high a response rate, but they tend to be a little bit easier to implement, that kind of thing. However, people who return mail surveys tend to have higher levels of education, which is also, like age, probably related to client satisfaction as well. So typically, in a client satisfaction study, you can expect good ratings, but there are some explanations for these high ratings that we probably should talk about real quick. So more satisfied and higher functioning clients are more likely to complete those questionnaires, and because they're more satisfied and higher functioning, their ratings are probably going to be better. There's also a lot of threats to internal validity, and this is just a callback from last semester. So that social desirability thing is pretty important. So clients are often thinking, well, I like that social worker, and I want her to like me, and I want her to continue to want to work with me, so I better say something good. This is true even when we tell clients that their responses are anonymous and don't affect their eligibility for services or anything sort of going forward or anything like that. And then, of course, there's all the issues related to recall bias and interviewer bias. I mean, simply asking the question predisposes people to sort of sugarcoating the truth, if you will, or just sort of saying something tepid or warm as opposed to saying something neutral or constructive or negative. So a few other explanations for high ratings. It's often one of the ways that clients express gratitude is through a client completing a client satisfaction survey. They may not say thank you during the course of the client satisfaction assessment, but they feel like it's one way they can give back to the provider and that it's sort of useful for their career or something like that. Medication, which sort of influences functioning and levels of change, is one reason why ratings are high as well. But then psychometrics are a big issue, so that reliability and validity thing, again, we talked about that last semester. That reliability and validity thing is sort of a key point for high ratings. And then there's this idea that cognitive dissonance helps to drive high ratings, and that's basically clients saying like, well, I've invested so much time and energy and hope that it artificially inflates my perception of change, and that sort of artificially inflates my level of satisfaction. So as a sort of general rule, client satisfaction studies are likely to give us good results. They're likely to survey only people who are sort of pleased or satisfied in some way. And they don't have a whole heck of a lot of construct validity. So let's talk about some recommendations. There's some literature out there, and there are some people who are working on sort of client satisfaction scales that have good reliability and have good validity. And really what needs to happen is that these need to be adopted sort of across the board by agencies. There might be some cost or some energy associated with that on the part of the agency, but in order to sort of beef up the validity of our client satisfaction studies, that's probably what we need to be doing. So we need to use the same instrument. We also probably need to use one or two open-ended questions, and then sort of we need to think about the way we collect data. And that's probably to use a ballot box approach, and that's to give a client the survey form, ask them to fill it out in the waiting room, and then drop it off in sort of a locked ballot box that's at the at the doorway to the agency or something like that. So that preserves anonymity and sort of gives clients the impression that their opinions are worthwhile without their opinions being linked to their treatment record. A couple of more recommendations. The idea is not to focus only on solving problems of dissatisfied customers, but it's to leverage the strengths, leverage things that are going well. It's important to keep expectations realistic. Agencies that are smaller have very small samples, or have very small client rosters. That's essentially a small sample, and so we can't overgeneralize from those small samples. Probably important to look for behavioral indicators as well. So if clients report high levels of satisfaction, does that also mean that they're changing? Does that also mean that they're sort of getting better and services are effective as well? And then, of course, we need to think about response rate as well. So the higher the response rate, the more sort of believability, the more sort of validity a client satisfaction study is going to have. So just a few concluding comments here. Again, I want to reiterate that client satisfaction by itself isn't the only dimension of evaluation an agency can use. It's usually one of 2 or 3 or 4 indicators that an agency will have to use. The others are something like cost. And that might come from a cost-benefit analysis. Something else might be really an outcome evaluation. So how are clients changing? Nevertheless, despite the sort of limitations of client satisfaction studies, they do have some utility for the agency, particularly for its administrators. They just have to be administered thoughtfully. All right, thanks for watching, and as always, if you have any questions, don't hesitate to get in touch with me. All right, thanks very much.